Gentlemen, we need to talk about your prostate. Ignoring problems doesn't make them go away, it makes them worse. I'm Dr. Emily Carter, a therapist and gerontologist. Today, I'm sharing the early warning signs most men ignore until it's too late. 1 in 8 men will face prostate cancer, but common conditions like BPH and prostatitis also impact millions of men of all ages. BPH affects half of men over 50. These conditions are very treatable, but only if you catch them early. Many ignore signs because they're embarrassed or think it's just aging. But waiting can lead to serious consequences. This information could save your life. Pay attention to your body and speak with a professional today. Don't be that guy. Learn these 5 warning signs. And if you have them, see your doctor. Early warning sign number 1. Changes in urination frequency, especially at night. This is often the very first sign men notice. You start waking up at night to urinate. Once, then twice, then 3 or 4 times. This is called nocturia. When you're young, you sleep through the night, but as your prostate enlarges, it presses on your urethra, the tube that carries urine from your bladder. This pressure makes you feel like you need to urinate even when your bladder isn't full. During the day, you also notice you're going to the bathroom more often. Every hour, every 30 minutes, you start planning your day around bathroom locations. You know where every public restroom is. This frequent urination disrupts your sleep, affects your work, limits your activities. Many men think this is normal aging. It's not. It's a sign your prostate is enlarging. Don't ignore it. Early warning sign number 2. Difficulty starting urination or weak urine stream. You stand at the toilet and nothing happens. You wait. You push. Finally, a weak stream starts, or the stream is not strong like it used to be. It's weak, slow, dribbles. Sometimes it stops and starts. Sometimes it splits into 2 streams. This happens because the enlarged prostate is squeezing your urethra. It's like putting your thumb over a garden hose. The flow gets restricted. You have to strain to empty your bladder. This straining can damage your bladder over time. Some men also experience hesitancy. You feel the urge to urinate, you go to the bathroom, but then you have to wait 10, 20, 30 seconds before urine starts flowing. This is frustrating and embarrassing, especially in public restrooms. Early warning sign number 3. Feeling like you can't completely empty your bladder. You finish urinating, you zip up, you walk away, and immediately you feel like you still need to go. You go back to the bathroom. A little more comes out. This incomplete emptying is very common with prostate enlargement. What's happening is your bladder muscle has to work harder to push urine past the blockage caused by the enlarged prostate. Over time, the bladder muscle gets tired and weak. It can't squeeze hard enough to completely empty, so urine stays in your bladder. This leftover urine increases your risk of bladder infections and bladder stones. You might also notice dribbling after you finish urinating. You think you're done, you put everything away, and then a few drops leak out. This is called post-void dribbling. It's embarrassing, but it's a clear sign of prostate problems. Early warning sign number 4. Sudden, urgent need to urinate. You're sitting in a meeting, or driving, or watching a movie. Suddenly, you have an overwhelming, urgent need to urinate right now. Not in 5 minutes, right now. You have to drop everything and rush to the bathroom. Sometimes you don't make it in time, and you leak urine. This is called urge incontinence. This urgency happens because your bladder becomes irritated and oversensitive from the chronic obstruction. Even a small amount of urine triggers a strong urge. Your bladder muscles can also become overactive, contracting when they shouldn't. This urgency can be terrifying. You're afraid to go places where you don't know if there's a bathroom nearby. You avoid long car trips. You sit near exits. You stop going to movies, concerts, or sporting events. Your life becomes limited by your prostate. Early warning sign number 5. Pain or burning during urination. If you feel pain, burning, or discomfort when you urinate, this is not normal. This can indicate prostatitis, which is inflammation or infection of the prostate. Prostatitis can happen at any age, even in young men in their 20s and 30s. The pain might be in your penis, your lower abdomen, lower back, or perineum. You might also feel pain during ejaculation or have flu-like symptoms. Prostatitis needs treatment. It won't go away on its own. Depending on the cause, you may need antibiotics, anti-inflammatories, or therapy. These signs can also indicate prostate cancer, which often has no symptoms in its early stages. By the time symptoms appear, it's often advanced. That's why screening is vital. The PSA blood test and digital rectal exams are key tools to detect abnormalities early. Men should discuss screening at age 50 or earlier at 45 or 40 if they are at higher risk due to race or family history. Age, family history, and race are major factors. Obesity, lack of exercise, and a diet high in red meat also increase your risk. Don't ignore the signs. Talk to your doctor today about your prostate health. Early detection saves lives. If you have any of the 5 warning signs I mentioned, see your doctor. Don't wait. Don't be embarrassed. Your doctor has seen and heard it all before. They won't judge you. They want to help you. What will your doctor do? First, they'll ask about your symptoms. How often do you urinate? Do you wake up at night? Is your stream weak? Do you have pain? Then they'll do a physical exam, including a digital rectal exam. They'll check a urine sample for infection. They might order a PSA blood test. They might do an ultrasound to measure how much urine is left in your bladder after you urinate. Based on these tests, they'll determine if you have an enlarged prostate, prostatitis, or if further testing is needed to rule out cancer. For benign prostatic hyperplasia, enlarged prostate, there are several treatment options. Watchful waiting if symptoms are mild, medications that relax the prostate and bladder neck to improve urine flow, medications that shrink the prostate over time, minimally invasive procedures that remove part of the prostate, surgery to remove the enlarged portion of the prostate. For prostatitis, treatment depends on the type. Bacterial prostatitis needs antibiotics for several weeks. Chronic prostatitis might need longer treatment with antibiotics, anti-inflammatories, alpha blockers, and sometimes physical therapy. For prostate cancer, treatment depends on the stage and grade. Options include active surveillance for slow-growing cancers, surgery to remove the prostate, radiation therapy, hormone therapy, and newer treatments like focal therapy. The key is early detection. When caught early, prostate problems are very treatable. Even prostate cancer has a very high survival rate when detected early. The 5-year survival rate for localized prostate cancer is nearly 100%, but you have to take action. You have to pay attention to your body. You have to overcome the embarrassment and talk to your doctor. Let me be very clear. These symptoms are not normal aging. Yes, prostate enlargement is common as you age, but you don't have to live with the symptoms. Treatment can dramatically improve your quality of life. Imagine sleeping through the night again, not waking up 3 or 4 times to urinate. Imagine going on a road trip without planning your route around rest stops. Imagine going to a movie without sitting on the aisle near the exit. Imagine not living in fear of not making it to the bathroom in time. Treatment can give you your life back. But first, you have to admit there's a problem. You have to see your doctor. I understand it's uncomfortable to talk about bathroom problems. I understand you don't want a rectal exam, but your health is more important than temporary embarrassment. Your doctor is a professional. They've done thousands of these exams. It takes 2 minutes, and it could save your life. So here's what you need to do. If you have any of these 5 warning signs, make an appointment this week, not next month. This week. Write down your symptoms before the appointment. Be honest. Be specific. How many times do you urinate at night? How weak is your stream? Do you have pain? If you're over 50 and haven't had a prostate exam and PSA test, schedule one. Prevention is key. Even if you have no symptoms, early detection makes all the difference. Talk to the men in your life, your father, brothers, and friends. Encourage them to get checked. Men don't talk about this stuff often, but we need to. Prostate problems are too serious to ignore. Your prostate is small, about the size of a walnut, but it can cause big problems if ignored. Pay attention to the warning signs. Take action early and get treated if needed. You deserve to sleep through the night and live without constant worry. You deserve to enjoy your favorite activities without anxiety. You deserve a healthy prostate. Take care of yourself. Don't ignore the signs. Be strong enough to see your doctor. Schedule your checkup today. Your future self will thank you.